Ventriculomegaly is defined as abnormal enlargement of the ventricles within brain. It is divided into two major categories, such as hydrocephalus and decreased cerebral volume. These entities are not mutually exclusive or can coexist in a single patient. Hydrocephalus is increased intracranial pressure from increased cerebrospinal fluid, mainly divided into two types such as non-communicating or intraventricular obstructive type and communicating or extraventricular obstructive type. Non-communicating or intraventricular obstructive type. Cerebrospinal fluid cannot exist the ventricular system. Upstream ventricles get dilated with mass effect. Causes are at foramen of Monroe level, colloid cyst, subependymal nodules and subependymal giant cell astrocytoma. At aqueduct of Sylvius level, aqueduct stenosis and tectal plate glioma. At fourth ventricle level, posterior fossa tumor, cerebellar hemorrhage and congenital anomalies such as Chiari malformations and Dandy-Walker malformations. Communicating type hydrocephalus. Cerebrospinal fluid can exist the ventricular system. Occur either due to obstruction of cerebrospinal fluid reabsorption such as extraventricular obstructive hydrocephalus and increased cerebrospinal fluid production. Defective reabsorption occurs in subarachnoid hemorrhage, meningitis and leptomeningeal carcinomatosis. Increased cerebrospinal fluid production occurs in normal pressure hydrocephalus and choroid plexus papilloma. Fetal ventriculomegaly. Should measures at atria of the lateral ventricles. Atria of lateral ventricle or trigone point at which the anterior horn, posterior horn and temporal horn meet. Measured an axial plane with the cavum septi pellucidum as an anterior landmark and ambient cistern as posterior landmark. Fetal ventriculomegaly defined as an atrial width of 10 mm or greater. Borderline 10 mm to 15 mm and severe more than 15 mm. Rate of associated malformations is subtantial in fetuses with severe ventriculomegaly. Neonatal or infant ventriculomegaly. Ventricular size vary depending on the age of baby. Differentiating ventriculomegaly from normal is difficult. In neonatal ventriculomegaly, any pathology that is seen in fetus can be seen in neonates also. Ventriculomegaly in the setting of chromosomal abnormalities, non-genetic syndromes, abnormalities of the midline development and neuronal migrational disorders can be seen. Benign subarachnoid space enlargement of infancy. Isolated enlarged subarachnoid space with or without enlargement of the ventricular system in patient with increased head circumference and normal neurology during first year of life. Self-limited resolves without therapy within 12 to 24 months. Differential diagnosis of benign subarachnoid space enlargement of infancy. Cerebral atrophy, acquired extraventricular obstructive hydrocephalus and non-accidental injury.